Team, welcome back to the Process Podcast. Today we sit down with our physio here at Coastal Fitness and my physio, Elena Hobson. She is one of the best at understanding the nuances of the sport of CrossFit and how it impacts the body. And in this episode, we unpack some of the really common things that she sees from an injury perspective and how to fix it in the sport of CrossFit. We also dive into the concept of pre-competition phases, meaning the 4 to 6 to 8 to 12 weeks leading into a competition and what might be happening to the body then and what to do about it. Elena Hobson, welcome back to the Process Podcast.
Thank you. Thank you for having me.
How are you doing today?
I'm really good. Yeah, really good. Had a good training session, so I'm pumped up and ready to go.
So that's why you're really good. Pre-training, were you good?
I was good pre-training, yeah, but I'm better post-training. It's good. I've got that feeling like, when you really express yourself on the gym floor and then you really feel satisfied that you've done something cool. We snatched today, which is my favorite. So yeah, feeling like I've already won the day and then everything else from here on is just an added bonus.
Love it.
So it's cool. Yeah.
Okay, we're gonna create a bit of context before we get into this today.
Mm-hmm.
Eleanor, you own a company called Body Shadow.
I do.
You are working out of this gym, Coastal Fitness, and so we've had the pleasure of having you here for quite some time now.
Yeah.
I feel extremely fortunate to have you here. Personally, when I need you, you always fix me and get me back on track. And I think the rest of the team can say the same thing. But I think we have a really cool, unique ecosystem whereby we have so many people training here in different services, and we have you, to help. I don't want to say help put them back together because I hate that stereotype where it's like CrossFit gyms break people and physio, mend them.
Yeah, it's not true. Yeah.
No, but it's like
Helps
we
us
have this
push people
amazing
forward.
ecosystem
Yeah.
where, with anyone who has any niggles beyond the scope of practice and what we can do as coaches, it's like, all right, go see Eleanor, she'll sort you. And then we have this really cool, system where you
it's
throw
really
that
nice.
back in.
Yeah,
And then,
it's about giving people direction, right? And really teaching them like where they need to go with their training and what they need to change to give them further success. So yeah, thank you. I appreciate being here too.
Well, you know what? One of the things that, we spoke about quite recently was like, you have a very specific area of interest within physiotherapy. You've been doing this a really long time. You've worked with people from all walks of life, but there is something that attracts you to the type of clientele that we have here.
Yeah.
Okay, so can you tell me a little bit about that?
Yeah, definitely. I think that I guess within the scope of what we do here, we have a lot of people obviously who are interested in pushing themselves. And I think that our like subsector, if you like, of the universe or of people in general is that we've got people who are interested in working hard, training hard and sleeping well and eating well, and expressing life well and doing things hard and trying new things and really looking to push forward is a very active community and not a passive community. So as a physio, I've found in the past it to be quite frustrating when I guess I give people the roadmap on how to get better or like how to manage themselves, but then they choose not to do that. And so then it becomes a really repetitive cycle where they just come in again and then I feed the same information and then they come again and then I feed the same information. So in your community and our community, I think that people really want to learn and want to take on how to be better and how to move well. And then I see such amazing progression. Even just about 45 minutes ago, I was talking to Ant about the progression of some of the clients that have been here for a long time, and the way that people are moving now compared to when I came here is quite different. So for some people who have been here for a long time, which is so satisfying to see. So yeah, this is my 8th year. I think this is the start of my 9th year. So just to give you context as to how long it's been, I came in 2018. Yeah.
What I also really value about you is that you, like you just said yourself, you're a part of our LPC program. You've been doing this training and I guess actually lots of different forms of training over the years, but you really understand what demands being placed on the clients. You understand the intricacies of a snatch, of a handstand push-up, of kipping on a bar and the rings. And because you have that level of understanding and knowledge, because you're also doing it and practicing yourself, it just like it's just a really nice fit.
It really adds value for sure. Yeah. And actually you're absolutely right. Doing it is still not the same as understanding it. So on paper, sometimes I don't think a workout's going to be really tough. And then I go down and do it. And I'm like, oh my gosh, the stimulus today was really not what I thought it was going to be. Like I've got sore abs this week from not doing abs in training, and I was trying to work out what it was, and it's because we've been doing the loaded strict pulling work. And so, you know, I was really working on my positions when I was doing my eccentric pulling work, and it's really transferred into my weakest link, which is my abdominal wall. So it was really satisfying to like go through that experience. And then I said to someone else in class, "Oh, have you got sore abs?" "Oh yeah, I do." And so yeah, it really makes it I'm really present in this community, which I really love. It's
Love it.
cool. Yeah.
Okay, context for today in terms of the calendar. We are, as of recording this podcast,
Yep.
about just over 4 weeks out from the CrossFit Open. And we're going to have a large majority of people in this gym doing it. I don't know if you know, but we're running the fitness league this year. We've got a really
Okay.
cool like
Yeah,
internal
cool.
comp that's going to be happening. That's just going to be good vibes and friendly competition.
Always.
But obviously, our training program LPC matches up to the CrossFit season. So we're basically entering what we're already in it actually, a pre-competition phase. But when we look at the whole year, when the season finishes and the open and quarterfinals is done, we basically go through this big rebuilding phase, right? So we're doing, lots of slow time under tension. We're doing more isolation work, all the things that we basically didn't do in the 16 to 21 weeks leading up to competition,
Yeah.
kind of like just rebuild our structures and our foundations. But that's not where we're at right now.
No.
We're in like the full-blown mayhem of, throwing the kitchen sink at our members, basically, exposing them to the intensity and the potential things that we might see show up in the CrossFit Open. Because when it does come in 4 weeks' time, we want them to be ready and to know they can look back on the last, 12 to 18 weeks and be like, I have done this, I can do it.
Yeah.
I can also strategize effectively because, I can remember when I last
What
did
it was
something
like.
similar.
Yeah.
But I think with this period of time, this like run into a competition, I'm sure you see some different things popping up from the clientele that maybe you don't see in like the normal training calendar when we're not, laser focused on a goal. So I think maybe a good place to start is like break that down, like training in this period of time leading into a comp. And we're talking like, 4 to 6 weeks out versus training for the rest of the year.
Yeah. So yeah, it's quite different on the body, really. I think that maybe a good way to describe it is that we're usually working underneath what we would call the red line. So the red line is normally kind of your limit of capacity, whether or not it's in your strength space or in your fitness space, but essentially you can't go any further. And the sweet spot in really like productive training is just underneath the red line. So as we go into this intensification, we go closer and closer to the red line, and maybe we test to see where the red line is so that we're feeling a bit more confident when we compete, because we want to put it all on the gym floor when we compete and when we're having fun in competition. So I suppose where I sit is that injury exists above the red line. So if you step too many times over the red line, then you might end up hurting yourself. So I think that in this high intensity training phase, as we're progressing towards competition, people are stepping over maybe a little bit, sometimes stepping over a lot, hopefully not too far where they actually get really properly injured, but things like the little niggles or the small whispers that you had, maybe earlier in the year, 6 months ago, if you didn't address them 6 months ago, then they start talking louder, and then eventually they might actually start blocking you from being able to express a movement pattern. So we see more and more of the whispers becoming louder, essentially, is what happens in this phase, because people are generally quite well in this phase because they've brought themselves here ready to compete. But then as they start to push, they recognize that, oh, maybe 6 months ago I might have listened to that whisper a bit more or something like that.
You know what I often find is that when I'm in these phases, because I'm pushing that red line and maybe stepping over it a little bit too often, which I've done in the past. Also, sorry, I should be honest, often not getting close enough to that red line, which means that when I actually do compete and I go way over it,
It's a surprise.
it's a complete shock to the system. I think actually for me, that's where most of my problems arise.
Right.
Because I just haven't put in the prep necessary to match the intensity of competition.
Yeah.
But anyhow, what I also find in these phases is because we are generally pushing, kind of like, when you think about that nervous system, the parasympathetic versus sympathetic, we're spending a little bit more time in the sympathetic state. And I do find that like, I'm just a little bit more numb. Do you know what I mean? It's like I kind of come into these phases where there are pre-existing niggles, and then I actually have this kind of opposite feeling where I'm like, all the niggles are just gone.
Yeah.
And I feel totally fine. And then, you do the run in, you compete, And then when you move back into that, parasympathetic state, then
Yeah.
suddenly I feel everything. And I'm like,
Yeah. So
whoa.
the adrenaline and the
Yeah, the
cortisol,
adrenaline basically
yeah, will
wears
get
off.
you
Yeah,
through
that
for sure.
cortisol curtain
Yeah.
drops, and
Yeah.
suddenly it's like, okay, I've really messed myself up. And I
Yeah.
can't tell you how many times I've done that.
Yeah, I mean, that's a really a tricky situation to navigate. And I think that's where maybe physio has a really strong role, because I can look at somebody and say, you know what, Ed, this is actually right on the limit of your capacity, and you might end up with a tear, or you might end up with an injury that will actually ruin your season, or this is quite safe, you can continue to ignore it. So, for example, you take some tennis elbow, you've got some tendon overload, and when it warms up and you've got the adrenaline flowing, your elbows are not painful at all, but then later on you might feel like, grippy workout really tips it over the edge, and then you can't even pour a cup of tea. That is actually still what we would consider a low risk injury. So the chance of that tearing off the bone or becoming like a muscular tendinous unit tear or something like that is actually relatively low. Is a stable part of the body, and you can kind of coax it through, and we can get it through the comp prep season without really worrying about you getting in trouble. Where something that might be coming off your neck, or like maybe a discompression, say from handstand push-ups or something like that, if you're starting to get high volume handstand push-ups and you're not respecting your eccentric phase, and you're landing on your head and you're starting to get shoulder pain, or some referred neck symptoms that are coming down your arms because of your handstand push-ups, that really should be respected. Because if you injure your neck by doing handstand push-ups, you could be in a lot of trouble. So I guess a lot of people don't really know which injuries are which, and that really becomes my role in this environment, is to help people with a clear diagnostic understanding of what's going on in their bodies, so they can then choose or not choose to run the risk of continuing to push.
Okay, how do we break that down on a podcast? Because obviously, like, this is so nuanced, right? You're gonna have someone come in reporting a pain or an issue that they want. They've obviously come to you. It's like, I can't fix this thing myself.
Right.
And then, like, is there a way for us to create a framework to give listeners at home to be like, well, what are the things that you need to really listen to, and what are the things that maybe, you just gave an example of the elbows there. Or maybe another way to reframe the question is like, what are examples that you're seeing in the sport of CrossFit specifically in phases like this? Like, what are you seeing pop up more?
Yeah.
And in which cases is it like, crack on, keep on going, we'll address this after the season's done,
Yeah.
versus like, okay, we need to stop now?
Yeah. Tough question, super tough question. So that in essence is like the framework of what physio is, and a lot of it comes down to the assessment skill and the history and the storytelling behind an athlete that the physio can see and work with one-on-one. So that sometimes can take me a whole hour to actually really, for me, understand the risk factors associated with them going on. But I suppose one kind of marker that you can really rely on fairly well is what we call latent pain. So that is the aftermath. So, if you've been able to train through it and you've been able to have no pain when you're expressing your movements, and then later on you're getting some pain, I guess the length of that pain can really give you an indicator as to whether or not you're kind of okay, or if you're actually in trouble. So, if something is a bit painful for, a day or two, and it starts to fade away again, and you feel like you can reload and go again, you're probably in a fairly low risk situation. Whereas something that's lingering, we would normally really teach people to self-observe themselves and see, like, actually this has been lingering for 5 weeks or for 6 weeks or something like that. So the repetition of the same symptom showing itself again and again and again, and then it's lingering for longer and longer. So you have a great workout, but then for 2 days or for 3 days, or maybe even then 4 days after the workout, you're still experiencing that flare up or that latent pain, then you know that the condition is getting larger. And if it's getting larger, obviously it's getting riskier. So the structures that we talk about vary, and that varies the risk factor. So as I said before, disc is much riskier than tendon, but tendon can be really high risk if it's torn. I mean, probably the worst injury you can have in the body is a tendon tear, because the tendon surgical repair is quite complicated and doesn't repair well, and it's a long, slow rehab, and so we have to respect that timeline. So you shouldn't disregard tendons just because they're tendons, but if you're just knocking it around a little bit or bruising it, it's probably not going to be a huge problem. So, you asked me, what do I see, say, a lot of, for example, like a shoulder is a kind of a good example of this. If the humeral head, which is the top of the arm bone, is not having good expression or centralization within the joint space when you're in a high momentum based movement. So if you're doing, kipping pull-ups or chest to bars or muscle ups and your shoulders a little bit, say, loose, so to speak, and the ball is kind of whipping around the joint space, it will crash into things. And when it crashes into something, it will leave like a bruise or kind of a footprint where it crashed. So that is essentially called impingement. And what tends to happen is the tendon gets impinged between two bits of bone. So the ball will crash into the shoulder blade, and what gets impinged in between is the supraspinatus tendon. So if you're getting impingement or bruising on the edge of the tendon, it's kind of like taking a little hammer and knocking it on a tree bark. It's not going to be a high risk scenario. But if that was the whisper that you had 6 months ago, and you keep taking your hammer and you keep whacking it on your tree bark, then in 6 months' time, when you've been doing loads of intensification, you're ready for prep, you may well have actually worn a little hole in the edge of that tree bark. And then that little hole obviously can open up and then can become a big hole, and then it can completely rupture. So it's all on a progression. So I guess you just need to come to the physio and ask, like, what is my injury? Is it that I'm just knocking on my tendon and we in a bruise type situation? Is it low risk? Or do you think I've torn my tendon, and is it going to blow apart when I'm doing my big heavy movements? Yeah.
I want to actually share my example working with you recently on what we've been trying to fix.
Yeah.
Because I think it's a good illustration of that. The concepts work really well on paper, right? It's like, okay, assess your current level of pain. Let's say it's a 4 out of 10. Try something. If it moves to a 5, maybe that might not be. If maybe that's something you shouldn't continue to pursue, or we got to just change it up. If it moves to a 3, keep on doing it. If it stays at a 4, well, then you got to ask yourself, like, are you happy with maintenance, or do you want to get this thing to a 2 or a 1?
Right.
So I think with my knee, which I guess I've been seeing you about this forever. It's one. If it's not one knee, it's the other.
Yeah.
But it's this is like my notoriously good knee that's been having some issues. And I think you encouraged me to get an MRI after we went down the conservative route. Couldn't really get too much progression out of it, and then saw a bunch of different things. But basically, I was at a point. It was basically the Open last year, leading into it, where like this pain in my knee at a very specific point was like, it was just really painful, and it got to a point where that little point of pain, past about 45 degrees of knee flexion, became like a consistent pain even when I wasn't bending it.
Yeah.
And I think that was the point where I was like, okay, I'm gonna do the CrossFit Open. I'm gonna be smart about my choices. I can feel it with the movements, but after, I'm gonna really try and fix this thing. Anyway, I'm realizing as I'm saying this now, it's basically been 1 year and the thing is still not fixed.
Yeah.
But I did do other things throughout that time, right? I did a High Rocks Pro. I didn't do another CrossFit competition. That was the year before. But we basically took some strategies here. So number one, exactly as you said, it was like, I didn't really know what it was.
Yeah.
What was actually, I knew what the diagnosis, what the MRI was saying, but I didn't know what was actually contributing to pain and why I was feeling in this very specific point.
Yeah.
And so I needed to really understand that first, which you did a great job of explaining, the chondromalacia under the kneecap, that was just gliding and touching basically at this very specific point.
Yeah.
And here's what you got to do to do it.
Yeah.
To basically, to improve it. So like step one was, okay, your glute med is weak. Let's see if we can fix that and improve that. So I did loads of work and still doing it today. And that 100% improved the tracking of my knee. But the pain was still there.
Still there. Yeah.
Okay, well, what's the next thing? Then you talked about the quads being shock absorbers. And like, if we can loosen the quads, lift the patella, then you're not going to get that contact. So then I started doing that a lot more. By the way, I've slacked on that since having a child, but I'm still trying. And that started making a difference as well.
Right.
But then it was still not where I wanted it to be. Right.
Yeah.
So the pain had maybe reduced from like a 7 to like a 5, but it was like, I want to get to a 0.
Yeah.
So then the next thing we did was like, okay, we'll just totally unload it. No knee flexion. I think we did 8 weeks.
Yeah.
And let's see if just like not pissing it off anymore is actually going to fix it. So then I did that, and it definitely got it then from like I can't remember what number we're at now. Let's say we're at 5.
Yeah.
So it probably went from a 5 to a 4, but it still wasn't fully healed.
Yeah.
And so then I've been in this point where I've been like, okay, this pain is still kind of there. It's a 4, which is great. It's come down from a 7, but like, is it ever going to go by me being, just doing this less drastic non-surgical route? And then what I tried to do on Monday, I was like, okay, we did introduce running. I did a 10K, no pain at all running. Then obviously like everyone's getting amped up for the open. I've been
Yeah.
telling myself all year, I'm like, this year's not for me. I need to like prioritize my knee. And then obviously we're doing the fitness league, and I'm like, I don't want to not be a part of that.
You can have a
So
crack.
I'm gonna do the open this year.
Yeah.
But I'm really gonna, and I'm gonna, you have to hold me accountable to this. I'm not gonna do anything which I think is actually gonna put my knee at harm's way. So on Monday, I was like, I would like to see if I can snatch.
Right.
Like, see if this is actually pain. So I could feel it a little bit. I'd say that pain is like a 2 out of 10. You can definitely see my body's compensating a little bit, but there was very minimal pain. Anyway, did the snatch session, felt great. And then the next day I was like, okay, now I've gone from like a 4 and I'm back up to like a 5-6
Right.
now.
Right.
So I'm like, okay, is this a red flag? Are these alarm bells?
Yeah.
Or do I just give it an extra day? So today's now 2 days, and it's definitely now moved back down
Right.
to a 5. So
Right.
kind of like maybe just use it in this illustration is like, I've now decided, okay, I don't need to snatch again. I know I can snatch, if 80 kg shows up, I can probably snatch that, but I don't like the fact that it's pushing my pain back up the
Yeah.
ladder.
Yeah.
So I'm just not going to snatch again. And if
Yeah.
it does show up in the CrossFit Open, I will really ask myself the question on that day,
Will
do
I
I need
snatch
to
or
be
not?
doing it? Is
Yeah.
it worth it?
Yeah.
But I think like body weight stuff like that's okay. So I don't know. Have you got any
So
thoughts on that?
yeah,
You want to add in?
absolutely. Yeah. So for starters, you had quite a lot of questions in there. So I'll try and kind of systematically work through what I heard. But the first one was, what is it? And so obviously we used the medical technology that we have to take a look. So we go for MRI, which is going to give us the best impression of what's going on inside the knee. And then we can see what structure we're dealing with. So in your circumstance, obviously there's some cartilage loss, which really means that you've got arthritis. So is arthritis going to be incredibly risky in a high performance situation? And the answer is not really. It's quite a slow burner. It will, this has been accumulating across time. It will continue to accumulate across time. Are you going to make it worse by training heavy on it? Well, yeah, if you keep doing that across time, you'll keep wearing that hole bigger, but it will take time. So if your, I guess your desire or your wish is to really have a go this open because you want to do it with your friends or your community and you want to have fun with it, then it's fairly low risk for that injury. So you could, medicate it to help the experience nicer for you, or you could just leave it so it really is expressing itself to you so you can understand, but then you've made an active choice to flare it up a little bit. And I'm okay with you doing that because you're educated in what it is and what is the risk factor. If you had another different injury around that region, like for example, the distal quad attachment into your patella had a small tear on it on the muscular tendinous junction. If that was still active and I thought that was still a current presentation, I would really discourage you from opening that up because that's a muscular tendinous unit. And then if that tears open, then you're going to be in really like a 3-month rehab program. So then doing a snatch is not going to give you a great outcome. But I think the story that we've learned from your knees is that we've deloaded it, we've done all the tissue work, we've done all the self-management and the physio management on the tissue work. And we know that from tissue healing and the timeline healing that we've already passed, or we've given it the opportunity to heal. So the fact that it's still present really tells us that it's in the bony structure and that cartilage area rather than in the soft tissue structure because you already healed that. There's no muscle tear in the world that's still going to be torn after 6 months of deload. So we already, like by process of elimination, got some more clarity on what was the source of the pain, A, from the MRI, but also then B, from the pattern, and then from the systematic management strategy that then we applied to it. So each time you have an organized, logical pathway, you can gain information on each step, which is really something that I can help guide people with, because a lot of people get stuck in the washing machine of, oh, I did this and it was fine. I power snatched, it was fine, but then I squat snatched and it wasn't fine. And then I was only doing 50%, it was fine, but then I did 80% and it wasn't fine. And then if you think in the context of our sport as well, snatch is a relatively low load compared to clean. So, should you snatch or should you clean? Well, if you're getting from a 4 to a 5 out of 10 in your squat snatch, then your squat clean is going to be even worse. So you need to think about the relative weight on the barbell compared to the movement pathway as well. If you're doing barbell cycling, obviously it's lighter, but then the friction overload is going to be higher. So there's all these features that, like, the sport throws a different demand for each type of tissue injury. So understanding really the morphology of the tissue error, and then therefore the loading response on that tissue error, and then therefore what is the result likely to be, will give us the best opportunity to predict whether or not you're going to still be well after it. So in your situation, you can snatch, especially if it's low repetition. If it's going to be like a 5 RM, or if it's going to be, not a massive amount of touch and go squat snatching, then you'll probably be okay, but if it's going to be like heavy squat snatches followed by a
Yeah.
touch and go piece with a squat pattern in it, and then some wobbles, you're probably going to find that you've flared it up quite a bit. But even then, it's just going to be more pain, and it will eventually recover. But
Yeah.
from your history, it's been fairly slow. So it's like, are you willing to take another 3 months or 4 months after the open to get it back to a 4?
Team, I want to quickly interrupt this episode to give a little shout out to our sponsors today, Well Spent. This little journal has made such a massive, profound impact on my life since I started using it. When I started using it, I actually didn't know that it was backed by neuroscience, but now it totally makes sense. This has brought a ton of gratitude to my life. It keeps me on track and focused on the things I need to do day to day, and brings a lot of context as to how each day fits within the greater week and the greater month. So if you, like me, really care about trying to be a high performer and want to do everything you can to make that happen, I cannot recommend this journal enough. Use our discount code, The Process, to grab yours today. I don't know why I thought about this, but as you were talking there, I don't know if you've seen the meme. I think obviously I remind people of this meme because I get sent it way too often. But there's this meme where it's like, it says like, the doctor asks the patient like, how much pain are you in? And the patient says, oh, just a normal amount of pain. And the doctor says, you realize that the normal amount of pain is 0.
Yeah. I'm really glad you said that. That's actually on my cheat sheet over here.
Go.
So I wanted to remind everybody that normal is no pain.
Yeah.
And I think I would love to segue maybe a little bit towards SIJ and back stuff, because I have so many people that come in with just a little bit of back pain.
Well, actually, before you get there,
yeah, sure.
Let's just to close off the no pain piece.
Let's do that.
Okay, because I don't want people to think in this competition prep phase it's normal to have pain, because I think what we're saying, it's a part of the process, and there's a higher risk of it, and therefore it might be more likely relative to normal training when you're not pushing. But like, I've also had amazing prep phases where I'm pushing really hard and I have 0 pain and I'm great function. So is that an important reminder? And what are your thoughts? Or are you saying like, if you're not in pain, you're not pushing hard enough?
A little bit both.
Okay, nice.
I think that it's not normal to express pain all the time. I think pain should be a fluctuating environment, and your body is telling you what's going on inside of you. So if you're not pushing hard enough, you might not experience much pain, which is lovely. But then if you really want to be competitive, you're maybe not putting it out on the gym floor. So if you want to be competitive and you want to express your highest capacity, you do need to go there and you need to have a go. But the pain response afterwards can give you an idea if you have injury pain, or if it's just like a training expression. If you just have some muscle soreness and a bit of joint irritation because you trained heavy, that clears up in 2 days, that's quite different type of pain to I've got 4 or 5 days of lingering shoulder pain, and actually it's the whisper that I had 6 months ago that's now the same pain, and it's getting bigger, and then it's getting bigger again, and like now, like, am I in danger or not? So pain is just a communication tool from your body back to you, so you just have to learn how to understand what it's saying is really the key. But yeah, experiencing frequent repetitive pain in the same pattern and accepting that as normal is not normal. You need to listen to that frequent, persistent, same pattern pain.
Would you say that as a whole, CrossFitters are worse than any other community?
No, that's not true. That is a complete fallacy.
Nice.
Yeah, I actually think I remember.
My question was not that CrossFitters are more injured.
Oh, I see.
CrossFitters, because I know when the way you answered that, I think
you were right. I was going where you thought I was going.
Well, let's go where you thought I was going, which is like, are CrossFitters more broken than anyone else?
Right. So no, and I think that the injury statistics across sports, but it doesn't include a lot of new sports. But I think that traditionally, I think soccer has got the highest time away from sport from injury. I would argue that AFL football might be higher, but I don't know if it was in that study. So it's been a long time since I looked at that research. But no, I don't think that CrossFit is expressing the reputation that it has.
I had way more injuries as a rugby player than I did as a CrossFit. Like, I'm talking like, I mean,
external forces. External forces are just brutal on the body. Like in CrossFit, you're always dealing with internal forces only. You can control them. So no, it's not the highest injury sport. And then are CrossFitters more likely to put up with injury because they're resilient, determined humans? I don't know.
What have you found?
I mean, I only work in CrossFit now, so I'm not really getting a good spread across the board. I'm not seeing a lot of people outside of CrossFit. I'm seeing high rocks, but I'm not really getting much general population anymore. So I do think that our determination is quite high, and I think maybe we have the capacity to train with pain and not be scared by it, which I think can be a huge asset, actually.
Nice.
So yeah,
I always really appreciate when you are working with me, or I see you working with other people who, might be, just really injury averse or pain averse. And I just love your no nonsense attitude where it's just like, you're fine. get in and train. Obviously, you
Yeah.
don't say it to everyone,
Yeah.
but in most cases, like, hearing a physio
Yeah.
say like, you can still train, keep on going,
Yeah.
you're fine, make these adjustments, go. That's a massive reason why, I think we've all
Yeah.
loved having
And
you
that's
here.
actually one of the barriers in our industry, is that people don't come to physio because they think that the physio is going to say,
Yeah.
don't train, you must rest. And that is really not the best way to get better. And we have this really strong concept of relative rest when it comes to injury management. And if you completely deload a tissue to total rest, you also completely detrain that tissue. So it will lose its strength and its power. And then when you come back into your sport, it's a long road home. So, a long road back to where you were. So relative rest is important to deload the injured structure, cross-training, training around it, and then applying the required solutions is the way forward, rather than just stop. And like CrossFit's perfect because we have so much variety that we can easily keep training, and we can just manage injuries through with relative deload, an appropriate reload, and then we can bring people back without having to rest, which is awesome. Yeah.
Okay, I know where but you want to get down the route of like common injuries and things you're seeing in sport, but I want to just throw a bit of a curveball at you.
Sure.
Okay, if you were the director of CrossFit,
Oof.
so you can decide
Pressure.
what movements get tested
Yeah.
and what don't. But I want you to take this from a physiotherapy
Okay.
perspective. So
Yeah.
like, based upon like the injuries that you see, that you maybe ask yourself sometimes, like, I kind of just wish that wasn't in here
Yeah.
because I don't see that the benefit doesn't outweigh the
Yeah.
reward, the risk, sorry. What would those movements be and why?
This is not a personal answer.
No,
This is a professional answer, because we just had box step ups and I really hate them.
Okay, tell me why do you hate
They're
box
just
step?
hard. They're just really
Okay,
hard.
it's just hard.
Okay, no. So in the context of physio and injury, what movement would I like to see removed from CrossFit? I don't love the dumbbell snatch. You have to hinge to the floor, and a lot of people don't have great hinging range, and so it will increase the expression of lumbar flexion, and depending on what type of person you have. But obviously we work in a corporate space, in a corporate city, and a lot of people have a lot of flexion overdrive in their lives already. Right, yeah, exactly. And sitting is sitting. It doesn't matter how well you sit, you're still sitting. So then I guess adding that flexion under momentum with load, and it's also unilateral movement, so we can create some diagonals or loss of control. The barbell will essentially stabilize the body, and so if you're doing like a touch and go deadlift, for example, that's actually relatively safer than a single arm dumbbell snatch to the ground. And then of course, once you clear horizontal and you go overhead, it's now moving in space. So it's an open chain, high momentum, low stability movement overhead that requires a lot of moving body parts. So it's probably one of the hardest movements to express well, and injuries will show up, especially spine, lumbar spine, SIJ, and shoulder, and neck also throw up. They get thrown up quite a lot in a
what? I did not
snatch.
think that was going to be one of the movements.
Really? What did you think it was going to be?
Well, I don't know. You're going to keep on going.
Okay,
down
well,
the
there's
route.
more.
So that is that like the top one? Is that one of the things that you?
I mean,
see
you put me on the spot, right? Is the one that's the first one that came to mind? Is it the one that I see the most amount of injury? Well, we don't do it that much here unless we're doing intensification. So no, I don't see a huge amount of injuries from it because we don't have it in our programming that you program for us all the time.
I would say probably like one thing that, obviously looking at the dumbbell versus barbell is because it's a single dumbbell, the loading is quite light. But I definitely agree with all those things you're saying.
Yeah, but the RX load for the dumbbell in the open for a lot of people is actually pretty high. Yeah,
quite heavy.
Yeah. I mean, during COVID, it was light because you only had what you had. But even then, I still saw injuries from dumbbell snatching in COVID. So I think that maybe in the similar sort of vein, like a single arm overhead squat, dumbbell overhead squat is also a really challenging movement.
I just don't do it because I can't do it.
Because you've got no mobility. It demands a huge amount of mobility, and if you don't have the mobility, you're going to throw a compensation strategy. So then you're going to rotate in all sorts of weird places to try and get yourself down, and so that's quite injury inducing. It's really hard on the nervous system, on the CNS. It's a neural tensioner across the body. You've got a lot of spinal neural demand sliding that is demanded in that movement, and so it can throw headaches, and it can really be a bit of a problem.
I'd probably say of all the movements, it's probably the movement I program the absolute least. I think it's maybe ever showed up as accessory work 1 or 2
Yeah,
times
it's
a
quite
year.
niche, and people who
Yeah,
have
I just
capacity
think
for
it's
it's quite low.
especially in a class format, it's just such a
Yeah,
terrible movement because you got
exactly.
like
Yeah.
5% of a room who can actually do it, and then the scale is actually nothing like the movement.
Yeah.
You know, you're doing like heel elevated or dumbbell front squats, something. It's just not
Yeah.
the same thing.
I mean, even I noticed when one of our coaches came and joined us, and Liam was here, he really loved the kettlebell, and we would quite often warm up with a kettlebell, and we would be doing an overhead bottoms up windmill, kettlebell
Yeah.
windmill or something, which is a similar movement pattern. And across our community, we didn't express it very well at all. So yeah, I think that I love that we were doing it. It was a really good way to highlight where we had some deficits, but the sport's so big, you know, we don't have enough space for all of
Yeah.
this open chain control. So I think that it would probably be better just to not test it.
You know, when you said you started this with the box step up, I actually think the box step up is a movement that causes quite a lot of issues, especially when coaches are so hell bent on this like 24/20 inch.
Right.
Right, because for
People
most
are all
people, they
different
don't
heights.
have, they don't
Yeah.
have the available hip range
Yeah.
to get onto a 24. I'm talking about guys. We've got shorter legs.
Yeah.
The 24-inch box, and then adding load to it, you just see so much compensation to the
Absolutely.
hips.
Yeah.
So I actually think it's like one of those movements. When I program box step ups, I actually will rarely, if it's with load, I will never put a prescribed height of a box.
Right.
And would say like, pick a height that you can
suits you.
perform.
Yeah.
Yeah, exactly. With very little compensation when their top leg is doing the majority of the work
Yeah.
without hip shifting out. So
Yeah.
actually, I don't think that's a bad answer. I think about that all the time.
Yeah.
I'm surprised you haven't
Perfect.
said handstand push-ups yet.
They're
What are your
okay.
thoughts?
Honestly, closed chain, both hands on the ground. Most people don't dump on their head because they're scared. And so the fear actually outweighs the risk a little bit.
Yeah.
And people don't feel comfortable landing on their head. So if anything, I'd say people are quite conservative with their handstand push-ups, and only really in the elite or the sub-elite category where people are getting a little bit more brave. We're seeing people bounce off their heads. So,
Yeah.
and then the coaches here are really great, and you guys catch it early and we cut it out. Yeah. Or I see it and I'll ping you a little note saying
Yeah.
on the side saying, can you please talk to this person?
Yeah.
Let's not do that. Yeah. But actually, I think it's not enough of a problem.
One of the things I don't like about the back to wall handstand push-up is just the position that it puts your spine, and it makes stacking really hard.
Yeah.
Because it's basically because of where the line is, and the only real way, unless you're really strong and able to really push vertically, which most people aren't, there's
Yes.
some form of like
Yeah.
compensation through the spine to bring the upper chest into it.
Yeah.
I don't like the fact that it puts you in a thoracically lumbar extended position, which is traditionally quite weak for pressing, and then you have to press your body weight.
Yeah.
I like the wall facing handstand push-up
Yeah.
from an alignment and a stacking
Yeah.
perspective,
But
and I
so
feel
hard
like
because you have to do it properly.
it's way harder. You can't.
cheat.
Yeah, I'm terrible. I mean, I'm bad at back to wall, but I'm really
Yeah.
bad at wall facing. And I also do think that the wall facing is the bad part of it is hard to get out.
Yeah.
Like if you are struggling in a rep, there's no easy way to bail.
Yeah.
And where most people
Absolutely.
bail
They'll
is
do a
like they
forward roll or something.
Yeah,
Like,
forward roll,
yeah,
neck goes to
yeah,
the side,
so
and they
true.
crumble out.
Yeah.
So like I don't know. For
I
me,
don't
when
think
I
that people put themselves in that environment though, because
Yeah.
it requires quite a lot of bravery to do that. So unless you've been a child gymnast, you don't really feel comfortable going there anyway.
Yeah.
So, and we've got wall walks, which is a progression of the
Yeah.
same thing. And so actually we're improving our upside down spinal stacking anyway
Yeah.
by having wall walks included in the sport. So that's quite helpful, really.
Yeah.
I mean, we have the same
maybe
problem
this is just
upside down.
maybe it's just a personal thing because I suck at them. Just
Well,
get rid of
overhead
them.
range. So, I mean, this is a lovely. We've had a
Yeah.
few segues into topics that I want to talk about, but this is a great segue into what does go wrong when you have overhead range restriction, and that's one of the things. So, if your shoulder girdle is not mobile enough to allow you to lift your arms up, you will thoracically extend. So, I guess if you're standing on your feet, how is that relevant? Well, if you look at an overhead split jerk, for example, tends to be a heavier barbell. We're jerking the weight, so we're getting underneath, which means that you don't really have to propel it, but you've got to land it. And if you land that in a thoracic extension position, tends to also be a lumbar extension position in your split stance, and your overhead range is poor, you're just gonna like vertically crush your spine, and people get quite a lot of thoracic pain or lumbar pain in that situation. And so then when you're becoming elite and you're ready, or sub elite, and you're really wanting to push towards more capacity, you have to fix that. You can't just keep pushing through. It doesn't matter how strong you are. If you land a split jerk like that, you will break yourself. And so at some point in time, I find with our members, people accelerate and then they hit these like ceilings where they just can't progress. And this is one of the ceilings that they cannot get through that wall until they learn how to stack their spine more vertically, which means bringing the rib cage down, finding internal torque in the trunk while we're allowing extension in the shoulder. And the main reason why you're tight in that position, it tends to be lats. And then I see people stretching their lats also with thoracic extension, which is totally non-productive or mildly productive. So if you really want to stretch your lats out, everyone listening, if you're stretching your lats, you've got to be an internal torque. You've got to keep that rib cage locked down and your abs on nice and strong and tight to allow your lats to open and your shoulder girdle to open. Otherwise, you just keep stretching you back into extension.
You're just stretching something completely different.
Exactly. And then I guess like if we go back to the very original topic, is like, what am I doing with people here in this environment? That's what I'm doing. I'm teaching them like, stop stretching your lats and spinal extension. You need to find spinal neutral. How do you keep the spine safe if you want to stack 100 kilos overhead? And the way that you do it is you keep the skeleton in neutral. The skeleton doesn't like being in extreme positions, so extreme extension or extreme flexion or extreme side bend. So if you're loading outside of the neutral posture, that's when you're going to get injured. So, and that's the whispery niggle that starts when you've got 50% overhead jerk, and then as you progress through the season and you go 60%, 70%, 80%, and then pre-comp you're going to have a crack at 90, 95, or maybe 100%, then your spine's going to tell you, hey, actually your position has been bad all year. And so then the weight, the barbell exposes your problem even louder. And that's when they come running in. Oh, by the way, I've got a problem. I had up 6 months and I didn't come in 6 months ago.
I mean, it's amazing like how it sounds so simple, learning how to brace effectively, but it's still probably the one thing that most people in the CrossFit space, including advanced, like high-level athletes,
I completely agree,
still have no idea how to effectively do. And I'm talking about how to effectively do in isolation. Like we're talking about supine, lying on your back, no load on your body. Can you brace? And then obviously you put people upside down or hanging from bars or putting load over their head. Obviously the complexity and the challenge of it becomes exasperated.
And I think like you and I think we sit on the same bench as we understand what bracing is, but I think if you ask people what is bracing, they don't even know what it means. And to me, if I were to answer that today, that what bracing is allowing your body to stay in neutral while you stack it with an external load. So you've got a lumbo-pelvic position that equals neutral, and you've got a shoulder thoracic position that equals neutral, and you've also got a skull neck position that equals neutral. So if you can keep your spine neutralized, and then you wrap the muscles around that to hold it under load, that's what bracing is. So it's not about like, hyperinflating or blowing your core out or using your external obliques to go sideways or like bracing your tummy if someone's going to hit you with their fist. There's so many different ways that are taught in the fitness community and in the physio community, and we don't have continuity yet across our team, sort of on the broader sort of spectrum, not here in Coastal, but in the world. The medical language hasn't really evolved yet for what is bracing. So people are very, very confused. Which is a problem.
I want to bring this back full circle to like this idea of like ramping up to a competition, because if people are listening to this now and maybe it's a CrossFit Open, maybe it's another sport that they're prepping for that requires the range of motion that CrossFit does. Don't know what sport that would be, but anyhow, and you're like, okay, this is me. Like I'm definitely not stacking and I'm experiencing maybe lower back pain or like shoulder pain. I think it's important to distinguish the different avatars that this might apply to, because we could have someone with fantastic mobility, of like the joints and of the shoulders and the joints and the hips, for example, where it's not a mobility limiter or flexibility limiter, but it's actually just learning how to brace and apply it. That's not me, but I know I've certainly experienced that with a lot of, especially females, who have, really great range of motion, and they have the ability to put themselves into some crazy positions that, I haven't ever been in since the womb, basically. And for those guys, it's really about teaching them stiffness and how to apply
controlling
that
neutral and flexibility environment is even harder.
Which I do think, though, in a competition prep phase, if that's you, that's something you can fix tomorrow. Start working on. You can start working on learning how to brace and then applying that to, more complex, bigger range of motion movements.
I mean, let me hold you there for a second. It's hard to apply that in this Open as we're prepping for it this year, because when you brace properly, you actually apply the training load into the appropriate musculature. So if you brace properly when you squat, now your quads have got to squat and your glutes got to squat. And if before you were leaning on your spine a bit, and then you actually apply your proper brace and you put the tissue tension into the appropriate musculature, you'll probably find that your weaker than you were when
Yes.
you braced badly. So then you might not want to express less weight in correct position for this competition because you've been working so hard for this year. So I guess the ultimate question is, what is the risk of you getting really injured if you continue your bad brace in this year's competition? And the answer is it depends on which tissues are getting injured. So if you have, say, an extension pattern, the compression and the extension loading is going to be in bony tissue. So that can be terrible for people who have got extension overload, maybe like volleyball players or water polo players. They have a lot of extension patterning. In jobs, for example, it might be like painters who are doing ceiling painting, or surfers, yeah, thank you, or basketball players or butchers, they're hanging meat. They have a lot of extension patterning. So if you've got extension in your life, you've got an extension overload, and then you're expressing extension overload in the gym, then your risk is going to be reasonably high, and the result of that is going to be fracture. You're going to get microfracture, stress fracture, or some sort of bony fracture to your skeleton. So obviously it could be a disaster. But if you're sitting in the office all day and you've got flexion in your life, and then you're just expressing a little bit of extension overload in the gym, then probably your bone tissue is going to be really hardy, and actually compressing it a little bit under 60% effort or 70 or even 100% effort, if we say, but only for one rep. Is it going to be that risky? Probably not, because you have earned the right to do it badly because you're not doing it all year round. So
that's the boat that I sit in.
Yeah, it's really relative to what have you been doing all the time. How do you look? What's your posture? And how much have you been doing that to yourself? If you've got a flexion overload, then the tissues that are at risk, say from like, we're talking about hinging or deadlifting, if you're rounding down and your spine is running into flexion a lot, say the dumbbell snatch that we talked about before, you can't reach the floor because your hamstrings are not long enough. That means you have to round down on your spine. So repeated round down is going to give you discal overload, and then the risk there is that you can get a prolapse or a soft tissue tear on your disc. That's a pretty big injury, and so that's going to be a long recovery, possibly surgical, and I would not recommend that you overload in that pattern. So depends on who you are and what you've been doing.
No, I appreciate you interjecting there, because it is true, right? When you the squat is a great example, especially like back squatting. See a lot,
good one.
Where there's like the overextension fault with when people are taught to keep their chest up. And then they end up kicking into all this arching, and they experience a lot of like back pain. And then, when you teach people how to brace and how to apply that to the squat, they're so weak. They feel less pain, they're more stable, but the loads they can lift are like 50%. So it's a very good point. Like, you got to weigh up that risk versus reward.
So this is a perfect correlation to this topic is putting your head through the hole in your overhead stacking as well. So like if you put your head through the hole, you're going to kind of stack your spine into itself, and you'll get some fake stability off of your spine. But it's not great for your neck. So if you then keep your neck in neutral and you go overhead, it requires more mobility, and you'll be weak in that position. So if you've earned the right through your training and through good positions to have safe skeleton, then you then can express poorly for that 5% of the time, and you're probably not going to get too injured. Ant's a perfect example. For example, I'm sure many people here know Ant, but listening to this podcast, but he hinges and he deadlifts with perfect form all the time and great bracing. So then when it comes to 1RM max, I'm quite happy for him to round down and express a terrible rep, because I know that his disc has been protected really for the majority of the year, where if I see people who are rounding down all year round, as soon as they increase the load, they're really highly at risk of getting injury.
Well, I think using Ant as the example, so like any flexion based activities, because he normally is really good at it and he's extremely strong, and I think his body type is really built towards like being good at that like hinging movement. But then when we talk about like the shoulders and going overhead, where he's less ideal, he runs into issues a lot more, because it's not just 5% of the time, it's actually now more like 50-60% of the time you're not moving perfectly. That's why you got nagging issues and elbows, etc.
And much love to Ant, but that's really why he's never going to express a heavy snatch in a really competitive space against his peers, because his positions are not allowing him for safe spinal stacking. But he's somewhat born like that, so you have to just work with what you've got, and he's tried really hard across many seasons to improve that position, and we've had quite minimal change. So I think for him it's really a structural challenge, and so I guess he understands that, and so now, and you understand that, and so you program accordingly, and like, okay, let's just keep your snatch as heavy as we think is acceptable for the sport, and then we're going to allow you to excel in other things that you're really good at. And that's the beauty of CrossFit, is that you don't have to be good at everything, which is great. It means us mere mortals can actually go somewhere. We can get scalps on those odd workouts. Okay, I want to talk
very quickly about SI joint,
Yep.
because I know that's something that you've been seeing quite a bit,
Hmm.
and you actually pull this back to a very specific workout that came out in the open that I think for you started to see this like rise in SI joint issue. So first of
Yeah.
all, what are we talking about when we say like
Yeah,
SI joint?
good question. Yeah. So this is a really heavy topic and big passion of mine, and I'm really excited that I get to talk about it. So thank you. The SI joint stands for the sacroiliac joint, and it's in the pelvis. So there's two of them, a left one and a right one. There's three bones that sit in the pelvis. There's an ilium on the left, the tailbone in the middle, and then an ilium on the right. And the three bones together make up the pelvis. And the SI joint is really where it's either side of the tailbone, and it's where the body weight gets stacked. So as you're standing up against gravity, your spine is resting in your SIJs. It's actually the largest weight bearing joint in the body. It takes around 60% of your body weight. That doesn't include your training load. And so it's really important. And when you stand on one leg, you can imagine that obviously that side then gets even more transfer of force through the SIJ. So the SI joint is really important for gravitational load, even more than the hip itself. So the hip is underneath the SI joint. So when Simon says, put your hands on your hips, Simon lied. That's not your hip. That's your pelvis. And that also irritates me quite a lot. So my kids will be learning, this is your pelvis, mummy. And your hip is beneath your pelvis. It's where your leg comes up and meets your pelvis. So yeah, the SI joint is critical. And because there's two sides to the pelvic, or to the SI, to the pelvic rim, if one leg goes forward and the other leg goes backward, that can create some torque at the pelvis. And you can get a rotational force that will slip one side forward relative to the other side. So there's no such thing as a backward slip of the pelvis. They only go forward, but the left one can go forward, which would be relatively out of a line compared to the other side, or the right one can go forward out of a line to the other side. And this is a really hot topic, both in science and not in science, in clinical space, because there's some really strong evidence that shows that the SIJ doesn't move. So we've got quite a lot of studies out there that show us that the SI joint doesn't move. And so when I tell people they have an SI joint rotational error, they're like, but I thought it didn't move. And that's what, your AI will tell you, because that's what the research shows us. So that's a bit of a problem. I don't really know how best to answer that other than my personal opinion, which is that those studies are done in cadavers. Those people are not living anymore. They've donated their body to science. They're rigid. They don't have body flow, they don't have muscle flow, they don't
Nervous
have
system.
anything. Yeah, exactly. And the way that they tested the movement error was to actually dislocate the hip. So they pulled the leg downwards, and they used a machine to pull the leg until the hip dislocated, and then they ended the test. And they showed at the end of the test that the SIJ hadn't moved. But actually, distraction force or longitudinal force isn't the type of force that will make the error happen around the SIJ. It's a rotational torque. So I actually think that the torque or the force that they applied to the SIJ was in the wrong direction. So then, of course, we're not going to see in that study that then we had an SIJ movement. And then this is something I'm particularly passionate about, because I've had this injury myself, and I've found a way to fix it. And I think that it's poorly understood in both clinical space, but also in medical space. It's non-imageable on an MRI. So an MRI is essentially a stack of 2D pictures. So you lie down on a bed, the machine takes a photo, and then they take 1 centimeter of skin off, and then they take another photo, and then they take another centimeter or millimeter, and then they take another photo. So it's just a stack of 2D films. And so actually the 3-dimensional torqued error is difficult to see on the imaging, because the imaging is still essentially a 2-dimensional film. So we don't have a good diagnostic inclusion format to be able to include this in medical science. So the doctors are limited by their profession to do no harm. So they can't treat something if they don't know that you have it. And they can't tell you that you have it because we can't see it. So we don't have a really strong diagnostic inclusion category for this injury. So it sits in the clinical space, which means that then you've got physios and osteos and chiros all looking at it and managing it in many different ways. And we don't have consistency yet in the clinical space. So it's creating a big problem, because let's say, for example, you have an athlete who's managed to injure or slip their SIJ, usually in a split leg position, say, for example, like a step out burpee, or like wide stepping lunges, or shuttle runs, which is what brings us back to 23.2. But let's say they've slipped the SIJ, and then they load it heavily, vertically loading it. So like a back squat, front squat, or a thruster, or an overhead catch of some description. It will create a lot of pain, and the pain can be quite extreme. It can throw high pain, it can throw sciatica, it can give you back pain. And when the SIJ is slipped, it will be A, painful, and then B, it won't resolve by itself. So you could lie in bed and rest for 6 weeks and your pain will go away because you've unloaded it. And then you can wake up and then get out of bed and start going, and there it is again. And then you can rest it for another 5 weeks, and then you get out of bed, and then there it is again. So it just doesn't get better. And then that brings me to this whole, like, some people have just got persistent nagging back pain that they've just learnt to live with, and that's not normal. And those people, I think, often fall in the SIJ category because the doctors have done an MRI and they've said your discs are fine, your spine is fine, and there's nothing wrong with you. So they've been told by medicine that there's nothing wrong with them, but every day they have back pain.
Can you
For me, that's a huge problem.
Can you just describe, Elena? Because obviously this is very prevalent, because I mean, there's so many people. I feel like almost every week are coming out being like, Elena, sort my SI issue out, and then like I feel great. And I know, you have a fix that you often use that used on me, and it's great. But can you just explain a little bit more about what the symptoms are, what people might actually feel when they might have an SI related issue?
So it's a back pain.
When you say
it's
back,
quite,
like upper, lower?
No,
low?
lower back pain. But it actually sits around the tailbone, so it's a very low back pain.
Okay.
And it's normally quite a small location, so it's like a pinpoint pain. You can like put your thumb on it, and if I put my thumb on the SIJ, that's where it is. How did you know? So it's quite a local pain,
and it can be on both sides, on one side.
It usually is one side at a time. It can throw problems to the other side, but normally it's one side at a time. So just one side.
And
pain
is it like,
is
it
standard
achy?
pattern.
Is it a sharp pain?
It's quite sharp. It hurts on loading, so single leg loading, and it's usually worse when you first load it. So like if you wake up out of bed in the morning, you were okay when you were lying in bed, and then you vertically load, and then there it's quite aggressive, and then you can normally walk it off a bit because it's inflammation in the joint space that creates the pain pattern. So then as you get some blood flow and you're moving around, it will start to ease off a little bit, but it will always still be there, but it will go quite low, to the point where if you're running or you're exercising, it can be 0 because of your adrenaline and your cortisol, and it can be a 0 pain, but then later on it will be really angry because you loaded it, so then it will go back up again. People often describe it as they're sitting at their desk fine, and then when they go to get up, they can't walk for around about 10 steps, and then after the 10th or the 15th step, they're able to walk through it, and then it starts to ease up, but then next time they sit down and go to get up, there it is again. So it's got a really like on-off sort of pattern. Like you can feel amazing and you run 10K and you think that you're finally fixed, and then the next day you're in big trouble. And so it's quite a confusing pain. People feel very unheard. A lot of people cry in my clinic when I help them with their SIJ, and they're like, finally somebody actually hears me and feels me and understands that there is something wrong with me, because we keep telling these people that they're fine, which is pretty miserable.
So one of the big contributors you said is like split leg movements.
So I mean,
and so what was that workout in the open that
the workout in the open is where we saw the introduction of the shuttle run. So it was the first time in CrossFit that we'd seen shuttle running, and also before the shuttle one was a burpee pull-up. We actually had 2 new movements in that workout, and so the burpee pull-up tended to be a step out burpee because we were trying to conserve our energy for the running, and then also just a side note, the part B of this workout was a 1 RM thruster. We had 5 minutes to build to 1 RM max effort thruster. So somewhere in the workout part A, I suspect that people were slipping the SI. And a note on this is that when the SI actually moves or slips, you don't feel it go. So it doesn't hurt when it moves. It just gets out of a line, and then it hurts when you load it. So the running, you wouldn't have even noticed. We were touching the line, and in our gym here, we've only got a 25-foot running space, so we're turning a lot, and so you're touching the line and turning and touching the line and turning. So there's a lot of up, down, hinging movement with a split leg position. So I don't know if it was the shuttle run or if it was the step out burpee that was creating problems, and I'll never really know. And I just must say, like, my disclaimer on this is just my personal observation with a clinical edge, because I'm a clinician and I'm starting to apply some clinical reasoning to this injury, but the science is not there yet for this, which is another reason why it's so poorly understood. And so then once the SI was then slipped, and then part B was the heavy thruster, and people are loading, pretty heavily with a big clean and an overhead press out. And then the next day, they couldn't do anything. And actually quite a lot of elite athletes fell out of the open that year. I was watching on Instagram and just silently on the side, and I just observed that some of our athletes that may have made it to the games actually didn't progress through the season. So I suspect that they may have had SI joint injury. And actually, I started following those athletes online who didn't progress through the season, and a lot of them had back pain for a long time, and some of them still do. So I don't think that necessarily they've got to the underlying cause of the back pain. And what can be quite difficult with SI joint is that it can coexist with other problems.
Yeah.
So it can create a disc problem. So then you MRI and you see the disc problem, but you don't see the SI. And so then my fear is that people will have spinal surgery to fix their discs, and that the SI will stay
So pain's still
rotated,
there.
and then they still haven't fixed their pain. Yeah.
Okay, so what's the fix? I don't know. Come on, you need to give it to us now, because
I mean, you just have to neutralize the skeleton. It's the same content that I've
Yeah.
talked about this whole time, is that you need to make it straight. And so we derotate the rotated side. So the error came from a torque around the pelvis. So we apply the anti-torque. So for example, if you have slipped the left side forward, the musculature that will pull the left side back is your glute max. So your left glute max will pull the left pelvis back. But if you just do one side, the whole unit's a little bit too mobile, the spine will move. So you need to have a counterforce on the opposite side. So you actually then would apply the right quad. So you do a quad activation on the right side to counterforce the left derotation through glute max. So
I
you
kind
would
of think of
apply,
it like it's like you're trying to squeeze scissors closed,
yeah.
but you're shoving a steel rod between the scissors, so they can't, like, you got like one force is driving up and one force is driving down. Do you know what I mean?
Yeah, I guess so. Yeah, you're applying
It's like
opposite
an
forces
isometric,
in
yeah.
isometric. Yeah,
Yeah.
exactly. And the right side would be a flexion force, and the left side would be an extension
Yeah.
force. Yeah. So I now have a number of different ways of doing it that have different levels of success depending on how mobile the human is. So some people can really relocate their SIJs really well, and some people really struggle to get them moving. They require quite a lot of force. But until their joint space is aligned and realigned, then the cartilage will keep swelling. So
Yeah.
you'll get cartilaginous swell in the SIJ joint space when it's torqued, especially if you load it. And so you just end up with a maximum capacity that you can cope with. So people are like, oh, I can load up to 60%, but I can't do anything more than that. So yeah, big problem, and we need to get them straight. And then when they're straight, the resolution is almost immediate. So people are like, oh my God, that feels so much better. And then they, within that week, they feel improved and have just so much more happiness. It's amazing. It's such a gift that I can give
you
people.
need to put like some information out there for the
I know,
for the just
yeah.
general world, like
Yeah.
something that you can do at home. Obviously nothing's going to beat coming in and seeing you and working with a practitioner
Yeah.
who can like really properly diagnose and
Yeah, I
give you
mean,
what you
yeah,
need.
you're right, but there's a large responsibility in the clinical space to only produce information that's factually correct. So until we can actually create some sort of research and some sort of studies that can give us a little bit more correlation with what we say we're doing, it's really just my word against your word. So you
we'll
know,
take
in my
it. We're
clinical
desperate.
experience, it's been really powerful, but from a research perspective, it's difficult to put together. So I think that there's still going to be a delay in our science on how to manage these SIJs until we accept that they actually move. And maybe they don't move, who knows, but I think they do.
Love it.
Yeah.
I don't know, like, for us to wrap this up,
Mm-hmm.
because this whole conversation, which has been awesome, by the way, and I love how technical you're going on this stuff. But you know, bringing it back into like pre-competition, you know,
Yeah.
ramping up for a comp. I don't know what the question is, but I guess it's like, what is the takeaway message here for those who are in that phase or going into that phase, or know that at some point in time they will be there?
Yeah.
What is your role? What is your advice? And from a physiotherapy standpoint, like, how can that be an aid that can actually help you? You know,
Yeah, I
be
mean, I
your very
think
best.
like overwhelmingly, you just have to get educated. You need to know why you have that pain, and which type of tissue is likely to be the source of the pain, and therefore what's the risk profile that then correlates with that type of tissue. So if you're in a high risk situation, you really need to tread carefully. And if you're in a low risk situation and you're just knocking that little hammer on that very big tree bark, this is a very low risk situation. So you can have freedom and expression of movement because you're confident that you really know what's going on. But if you don't know why you hurt, well, that's pretty naive, I suppose, to go into a competitive space not really knowing if you're going to make it or not. That's pretty risky.
Something that like really resonates with me now in my coaching philosophy with Coastal is that because I was that guy who knew the consequences of what I was doing but still ignored them. This is like, you know, my early days of CrossFit, and then, you know, I'm like a living example of what the end result of that is.
Yeah.
And I kind of just don't resonate anymore with people who know the risk of what they're doing. They understand the consequences, and they're already high up on the high risk scale of like causing serious long-term damage,
Right.
but they still
Do it anyway.
do it.
Yeah.
Because that was me. And I want to say that, like, that's why I have this strong belief.
Yeah.
I've found it very hard as a coach, especially working with high level athletes individually,
Mm,
to get behind those people
mm,
anymore. And I've
mm.
had a number of conversations where I've said, you know what, I don't think I'm the right guy to help you achieve that, because I have like a moral compass where I don't want
Right.
to be a part, and have said that that's okay
Yeah.
to do, because I think, like,
Yeah.
you know, your long-term health is
Yeah.
really
I mean,
important.
I would agree with that. I mean, one of the things that makes me a physio is that I love the human body, and I think that we should respect it highly. And if you disrespect your body, you'll pay the price, and you only get one body. Some parts are also irreplaceable. We can replace knees and hips, but we can't replace shoulders very well, and we cannot replace the spine. And so I think that, yeah, if you continue to push through and break yourself, then you're definitely going to wear the effect of that long term. And I also don't agree with that strategy.
Love it.
Yeah.
Elena, this has been fantastic as always. Where can people find out more about you, and how can they work with you?
Um, Tricky question. My book is actually closed.
Too
So
damn busy.
you can find me online at bodyshadowphysio.hk. All of the details on there are live. So my email address is current. My phone number is actually my personal phone number. I'm just a one-man band. I don't have any admin team behind those emails or behind those texts. So if you want to get a hold of me, you just message me, and I'll communicate with you about what is your problem and how can I help. Of course, I'm accepting new clients all the time if they're in our community. The coastal community are always welcome. That's why I'm here. And then if you really a friend of the community, or a friend of a friend, or if you're in trouble and you really think I can help you, then please reach out, and I'll find space for you to get you through the sticky phase and back into success. So yeah, you can find me there.
Love it. Elena, thank you so much for joining.
You're
Until next
welcome.
time.
Thanks for having me. Appreciate it.
Before we say goodbye, here's one crazy statistic for you. Did you know that almost 40% of people who listen to the show don't actually subscribe to it? Now, I didn't think that was a big deal until I actually learned about the power of hitting subscribe. For you, the listener, you get to stay up to date when we drop episodes on a weekly basis. But for us as a podcast, it really helps our visibility and helps us attract great brands and great listeners to help grow this podcast. So if you enjoyed this episode, or you're a big fan of the show, please do us a massive favor and hit subscribe. Thank you so much.